welcome each one of you to this momentous occasion. I extend a warm welcome to our esteemed doctors, Senior Consultant Surgical Oncologist Dr. Venkat P. and Consultant Surgical Oncology Dr. Priya Kapoor, whose expertise and dedication have been instrumental in achieving this groundbreaking success. I also welcome our valued clinicians, members of the media, and all of you who have joined us today. Your presence here signifies our collective commitment to innovation and compassion in the fight of cancer. We gather here to celebrate the historic achievement of South Asia's first successful bilateral nipple-preserving robotic breast cancer surgery. This breakthrough not only demonstrates our dedication to pioneering advancements in oncological care, but also offers hope to countless individuals who are battling against cancer, particularly breast cancer. The utilization of Da Vinci Xi, a robotic surgical system, underscores our commitment to excellence and patients' well-being. This procedure marks a paradigm shift in breast cancer surgery, providing our patients with enhanced aesthetic outcomes as well as improving their post-operative experiences. All the patients who have received this treatment are doing well today and are returning to their normal lives. The utilization of Da Vinci Xi robotic surgical system is truly remarkable. As we celebrate this milestone, let us also recognize the broader context of our fight against the breast cancer. The increasing incidence of breast cancer underscores the urgent need of improved awareness, early detection, and access to effective treatment. So at Apollo Cancer Centers, we are dedicated to empowering women with knowledge as well as innovative treatment options. Together, we strive to promote early diagnosis and proactive healthcare management, ultimately improving patient outcomes and transforming their lives. In closing, I extend deepest gratitude to every member of the Apollo family and to all those who have contributed in this achievement. Together, let us continue to innovate, inspire, and positively impact the world. Thank you for being part of this remarkable journey. My heartiest congratulations to Dr. Venkat P. and to Dr. Priya Kapoor. Thank you.
Dr. Gupta for sharing valuable insight on this important occasion. I invite Dr. Priya Kapoor, Consultant Surgical Oncology, to speak on genetics and young breast cancer, new realms in management.
Thank you, Dr. Sushila. A very good afternoon to all my dear colleagues and respected members of the media. So today we are here for this new innovative surgery, which is robotic bilateral nipple preserving surgery. I would like to start with some insight: breast cancer in younger women and genetics. Why are we talking about breast cancer so often these days? That is because breast cancer is the most common cancer affecting women in our country, with a very high death rate. And also it is important that we are seeing now a lot of patients with breast cancer in the younger population. We are seeing patients in 20 years, 30 years of age. So the treatment has to differ. We cannot treat someone who's 30 years of age with breast cancer to same as who's 60 years of age with breast cancer. Patients who are younger have a different set of challenges with the treatment process. It is also important to note that breast cancer now is 32.8% of all cancer in the younger population of women in India. It comprises of 1/3 of all cancers in younger population of women in our country. So what are the challenges younger women face with breast cancer treatment? There are heightened concerns about the body image. There are issues regarding sexuality, fertility, pregnancy, early menopause, because once they take chemotherapy, there are definitely issues with fertility. They go in for early menopause. Breast cancer in younger women is also more aggressive. Younger women have more dense breast tissue and it's difficult to diagnose in this set of women. So these are all the issues that they face once the treatment is started, because they are young, long life ahead. Quality of life is so important. So young breast cancer survivors have very much a quality of life issues. Then what is familial breast cancer and why is genetic testing important? As per the ASCO international guidelines, it started with breast cancer needs genetic testing in women younger than 45 years of age, or multiple members of the family having breast cancer, ovarian cancer, triple negative breast cancer, male breast cancer, etc. But now worldwide what we follow is any patient with breast cancer needs a genetic evaluation. Because as you can see here, about 30 to 35% of the breast cancer can be associated with genetic defects. And once these genetic defects are identified, the treatment differs. So the most common affected genes and associated with breast and ovarian cancer are the BRCA1 and BRCA2 gene, and it has 50% pass-on rate. So if one of the parents, either the mother or the father, both included have a defective BRCA1 or 2 genes, there is a 50% chance of each child having this. So as you can see here, associated risks are about 60 to 80% for breast cancer and about 40% for ovarian cancer. So out of 100 patients, 80 patients with BRCA1 defect will develop breast cancer in their lifetime, which is quite a significant number and needs to be addressed. So as you can see here, different mutations in the gene, we need to treat it differently, and it forms now a very important part of our treatment. So when we see a young patient with breast cancer, genetic testing becomes a must, and addressing their quality of life issues also becomes a must. Thank you so much.
Thank you, Dr. Priya. Very valuable thoughts on the interplay between breast cancer and genetics. I now invite a renowned surgeon, Dr. P. Venkat, Senior Consultant, Surgical Oncology, ACC Chennai, to speak on South Asia's first successful bilateral nipple-preserving robotic breast surgery. Over to you, sir.
Good morning, everyone. I would like to thank the media people and பத்திரிகை நண்பர்கள் அனைவருக்கும் ரொம்ப மாலை வணக்கங்கள் காலை வணக்கங்கள் ரொம்ப நன்றி இந்த இடத்துல வந்ததுக்கு. அதே மாதிரி உங்கள் டைம் பிஸி ஷெட்யூல் எடுத்துட்டு at the time of election, in spite of busy schedule, coming here is it means a lot to us. Okay. Thank you. See, today we are just going to talk about the South Asia's first bilateral robotic nipple sparing mastectomy. See, agenda is, it's like, again we need to discuss about how the evolution of breast cancer treatment started, and only then we will know then why, from where we started and where we have come now, and why should we do a nipple sparing surgery, and why robotic surgery for a nipple sparing mastectomy, and what is the advantages of the system what we should use. The system what which you have used is the latest system called Da Vinci Xi system. And again, if I speak about Angelina Jolie, your understanding about it will be more. Again, the psychological benefits of what the patient has because of this treatment. Again, see, when we started doing, that was way long, about 100 years ago, when breast cancer surgeries were started to be performed. Again, the surgeries were very radical surgeries, more aggressive surgeries, where the entire breast, along with the entire skin covering the breast, along with the nipple, areola, underlying muscle, everything was removed. That was the initial surgeries. This surgery was performed until as recent as 1970s. Slowly from then on, a lot of studies, trials have done, and then the surgeries have become lesser and lesser, and with the same effect, or a better effect also. And again, then after starting those aggressive surgeries, then there came a little lesser surgery called modified radical mastectomy, where the part of the skin, but the nipple and areola was also removed. Then came where only the tumor, then came what is called breast conservation surgeries for specific cancers, where a part of the tumor and the quadrant, the entire part, half or quarter portion of the breast was removed. So we started from there and slowly it's been evolving. And then if you see, now most of the incisions for in breast cancers will be like either what you see on the left side, a big scar, and again on the right side where it will be on the breast. It will be on the breast and it will be this size scar or a bigger scar, and it will be like that. So again, that is where then then now with a lot of progress and a lot of trials and research, and then now again we have come to a situation where we do a surgery called robotic skin and nipple sparing mastectomy, where the entire skin envelope and the nipple, which is also being completely preserved, where the part of the skin was removed and nipple was also definitely removed. All this is being preserved now with utmost principles of oncology, where you can preserve it and things like that. That has got a lot of impact on the patient, and there's no compromise on the cancer clearance, and the benefit what the patient derives out of this entire treatment is immense. Again, what is robotic assisted surgery? So during robotic assisted surgery, your surgeon sits in the, surgeon makes several small incisions, then uses a 3D HD camera for a crystal clear magnified view of the patient's anatomy. He or she sits at the console next to you and operates through the incision using tiny instruments and the camera. And every hand movement your surgeon makes is translated by the Da Vinci surgical system in real time, bending and rotating the instruments so he or she can remove your diseased organ. See, again, most of us would have seen the Da Vinci surgical, obviously the surgical systems have been predominantly used for intra-abdominal and intrathoracic surgeries, and now it's evolving. All the other organs are also being operated, where we can improve the outcomes of the patient. Again, the exercise system consists of three components. One is called the surgeon's console, where the surgeon sits in it. Next is called a vision cart. The vision cart is a communication between the surgeon's console and the patient's side cart. The last is the patient cart, where the patient cart is just adjacent next to the patient, which is docked with the patient. And the surgeon's, whatever movements which the surgeon makes in the surgeon's console is translated into the patient cart, and those fine movements and precise movements are being performed. And what happens during a robotic assisted surgery? The surgeon is with you in the operation theatre, is seated at in the console. Again, the surgeon has got a magnified view, which is around 10 times more than what he or she can normally see. And not only the 10-time magnification, it's also a 3D view. 3D view, it's an immersive 3D where you get a clear-cut picture. Again, the surgeon, with the help of the small instruments which can talk to the patient, your surgeon makes movements, and the small movements are translated by the very fine micro instruments to give a crystal clear surgery and give good outcomes. And normally the range of movements and the type of movements which the instrument can make with the Da Vinci system is more than what a normal human hand can make. So there are almost 7 or 8 different types of movements, and the ranges are very high range of movements. Can you just play the video, please? This is just a short video about the Da Vinci system. called tremor filter, where even a little elderly person, elderly surgeon, or some people have intentional tremors, where even the small tremor, if the surgeon has got, the tremor is being filtered while you operate. The system filters the entire tremor. So the movements are very precise. And again, micro anastomosis, where even a small anastomosis, small joinings can be done with absolute precision. And again, what we do, there's also a thing called motion scaling, where even if you do a bigger movement with your hand, that is only translated as a very small and fine movement when you are operating. Again, this system, robotic system, has also got telesurgery, where even you can operate from a different hospital, you can operate on another hospital or different thing. It's still evolving. Again, you can use, we have got what's called a multi-quadrant surgery. This is more important when you do an abdominal surgery, where you will be able to access all quadrants of the abdomen. Again, it's very versatile and very flexible. Again, Apollo Cancer Center, Chennai is amongst the very few private cancer centers to offer this cutting-edge technology. And Da Vinci is the only surgical robotic platform to have gotten US FDA and a European accreditation. Again, the Da Vinci as such, they have got a good vast experience of over 15 million procedures performed across all specialties. And again, now coming to evolution of robotic nipple sparing mastectomy. This is the first surgery by nipple sparing mastectomy by robotic was done by Antonio in Italy in 2015. Then again, another person in USA was performed in 2016. And again, Taiwan, again in 2016 and 2018, it was performed. So it's a recently evolving surgery, and it is not the only thing. It's not like many centers in the world do it. Very, very few centers in the world do it. Again, in US or Taiwan or anywhere in Europe also, very, very, very few centers do this highly specialized surgery. And we are the first, me and Dr. Priya were the first people to perform it in India, Chennai. And we performed it in 2023. And again, now coming to, all of us know Angelina Jolie. The world was shocked and was surprised, and there was a lot of disbelief when in 2013, March, she just mentioned that she gave a press release saying that she has undergone bilateral mastectomy and also bilateral removal of both the ovaries. So this is because Angelina Jolie, her grandparents, both her father's side and mother's side grandparents, had a history of ovarian cancer. And again, her aunt had a breast cancer, her mother had a breast cancer. So this is when she started, she wanted to find out whether there is any way to prevent it. And again, there was some genetic test which was done as mentioned by Dr. Priya. Again, genetic test was also patented only in US, as there was no genetic test available anywhere in the world as late as 2011. Only in after 2011 only other companies could do a genetic testing. Again, in India we have got genetic testing now, which we routinely do it and things like that. So again, she had a genetic testing done. The genetic testing proved that she had a gene mutation of one of the genes called BRCA1 gene, which is one of the commonest gene defect which causes a familial history of breast cancer. Again, then she took a very brave decision, and she had a detailed discussion with a treating oncologist, and then she underwent where both sides breasts were removed and they were reconstructed, and both sides breasts were removed and reconstructed, and again both the ovaries were also removed. In those days, there was nothing called a robotic surgery, because the first surgery was itself performed only in 2015. And again, she had undergone a conventional surgery, and again, only after that, the need of genetic testing was become more prominent, and again, patients it's very easy to tell the patients the entire story and make them understand, and they also Google it and read about it. Again, our patient, so far we have performed a lot of almost 16 patients, 16 surgeries, and again, this patient is a little bit more important for us, because this is one of the patients where she was a 37-year-old housewife. She was a mother of two pre-teenage children. She had two pre-teenage children. Again, she had a cancer of the right breast. She was a stage 2 cancer. The day she walked into the OPD, she was very apprehensive, anxious. She just walked into the OPD just with the swelling in the breast. She had not made any diagnosis. She was very apprehensive, very anxious. And again, then even the slightest of hint that it could be a cancer, she was very stressed out about it and very anxious about it. And again, we counseled her, we had to walk through her, help her out, and we took her, we got some basic investigations which we always perform for all patients. Then we got a biopsy done. Unfortunately, the biopsy turned out to be a little bit more aggressive type of breast cancer. That's called a triple negative disease. And after that, we had to again counsel her. We had to tell her that you need to first undergo a chemotherapy. So initially it was more of she had to undergo chemotherapy. Then slowly we had to talk to her about, because she's young, because she's triple negative, she falls under the criteria where she needs to undergo genetic testing. So we had to counsel her at every step. And again, we counseled her, we got a genetic counselor, we counseled her, we got her a genetic testing done. Again, by the time she was through the chemotherapy, as she was going, she had to receive 8 cycles of chemotherapy. As she was going through the chemotherapy, it was found that she was the BRCA1 gene positive. So again, the whole process of, she thought it could be one simple, easy, kind of already it was a difficult challenge. Again, she thought it was different, simple way only that side breast could be operated, it could be a different kind of surgery. Then again, we had to restart the whole thing. Again, after the BRCA testing came as positive, we had to sit with her, talk to her family, we had to have a detailed chat saying that it's come as positive. So there's a high chance of you developing a opposite side breast cancer, and there's a high chance of you developing an ovarian cancer. Again, she understood it. It takes time because by the time they finish chemotherapy, it's around 3 months. So we had to go through multiple sessions of discussion with her as to how to go about the treatment, and which will be good for a long-term cure and long-term outcomes. Not only we are not looking at just the immediate, maybe 3 years or 4 years or something. We are looking at a longer duration of her entire lifespan, which is good for her. So we had a detailed discussion. Throughout the thing, she just said, "Doctor, I just want to be there for my children." That was only in her mind. And at every time she said the same thing. Again, we took her through the entire thing. We had a detailed discussion, and she was also slowly she started like understanding it and things like that. And again, then we went her through then after in December 2023, she underwent a surgery where we had done the one side, whichever side. One side she underwent a mastectomy for which cancer was already existing. Another side she underwent a prophylactic mastectomy where the cancer was not there but the high chance of developing a cancer. Again, both the ovaries were also removed, ovaries and the fallopian tubules were removed also robotically. And again, this is what we did for her. And again, the interesting part about is where I told you Angelina Jolie had a family history of breast cancer. This particular patient did not have a family history of breast cancer. She's the first patient in her family to develop breast cancer. And she was like, she was amazed. That's why we always give the clear-cut guidelines for indications for genetic testing are any younger patient, less than 45 years of age. And that's a clear-cut guideline. And where, again, they are triple negative cancers. These are all aggressive cancers. And again, she was the first member of the family to undergo she had a breast cancer. She was the first member which also turned out to be BRCA positive. Then after that she gained our confidence, she gained our trust. She understood the entire thing that we are trying to do something good for her throughout the entire process. And again, then we went on to proceed with the procedure. Say again here, if you see there, what we do is we just first mark the it with the dye to mark what is called a footprint of the breast. So we need to mark the extent of the breast which is there. Then with the help of, we call it gel port, we do a small incision which is around 3 centimeters in the axilla. So why we do it there is because even if the patient keeps the hand down, there's no scar on the breast. It's more on it's almost something like doing a lymph node biopsy. So the absolutely scar will not be visible. And again, via which we put the gel port, and we put 3 fine instruments, and we dock the instruments to the Da Vinci robot. And with the help of the fine movements, we go all around. We're removing the breast. If you see, there's something called skin, and then the fat part is there. Then comes the real breast. So we go in between that area and above, all around 360 degrees, and then go below, and then remove the entire breast. And we also make sure, because the nipple, we need to be sure that the nipple also does not contain any cancer. So we always send, during the surgery, we send that portion of the nipple, inside portion, for what we call a frozen section. We get the report immediately and things like that. So then we removed the entire breast, and immediately we did what is called an implant-based reconstruction. We could put an implant inside, and this we did it for both sides, the right side and left side. We could do it for both sides. This is a surgery in progress. I'm just not putting the video of the surgery. This is how it looks during the surgery. And again, I'm just putting this photo just to show you that, say, I just cover the nipple, just to show you on the one on the left side is the pre-surgery photo, on the pre-surgery picture. The one on the right side is the post-surgery picture, where you see, if someone sees, no one even realizes that the patient has undergone, the breast has been removed there. Both the breasts have been removed, and what we have, the mold is because of the implant. So again, she was post-surgery, and again, this is the way it is. Traditionally, there's a big incision either down or around the nipple. This is the way a skin sparing mastectomy is done. Here, this is done with a very precision, with a small incision. There's absolutely no scar. The scar is will not even be visible after 6 months to 1 year of time. And the biggest thing was after surgery. It was so the same patient who was so anxious throughout the procedure, and again telling that removing both the breasts, both the ovaries, the very same day evening, not even the next day morning, the very same day evening, she was very comfortable. She could have normal diet. She was very comfortable. She was very happy because the psychological fear, the trauma of removing the breast, the entire thing was she was saying, doctor, I just don't even feel that the breast has been removed. The important part, the skin is there, nipple is there. Again, the breast is there. It looks like the breast is there because of the implant. So she was extremely happy because psychologically, I could just see a different person. What was different pre-surgery and it was totally a different person, and the personality completely changed. She was very happy. And that gives us a lot of joy and happiness, seeing the patients being very happy. And these are the advantages of the robotics nipple sparing mastectomy, is where we preserve the nipple. That's very important. Again, the skin is preserved. Again, the sensation of the skin, sensation of the nipple is also preserved. Again, one of the important things, because the system is, we get a 10x magnification, very small incision, and the recovery is very rapid. The patient has less pain, better cosmosis. There's absolutely no blood loss. The blood loss, what I will not even say. So what we do for a testing, say whatever, even before any surgery or any normal blood test, what we take it, the blood loss we give them lesser than that. And the patient, most important is again, better psychological outcomes. And why is all this so important? Again, this is very important because I mentioned again, the incidence of breast cancers are increasing. Again, there's an incidence, steady increase in number of breast cancers, predominantly in the younger population. And it's not only about just doing a surgery, also we need to think about not only about curing the patient, most important is giving them a good quality of life, again physically and mentally, and all this, it helps the patient in the long run. Again, they get a good quality of life, they get psychological, they have good outcomes, and they are very confident in their life. Again, our collective expertise, we have done close to 12 cases, but again, there were like instances where 16 was the number where we did bilateral. So all that put together, it's 16 case surgeries for breast, but again 12 surgeries. And all patients discharged in a single day with no complications. We are the first center in India to do this procedure. Again, our challenges. Again, we had to go for a international training, because no one does it in India. Again, we went to Taiwan and got trained there with Dr. Fiona. She was one of the very first people to do it. And again, we spent a good quality time with her. And again, there's lost few instruments. The gel port instrument was not available. We had to import it. Again, importing a new instrument is not being used is also a challenge. Again, we had to go through it. Again, our breast size are a little large. Again, it's technically more demanding than what we get it in Taiwan or Korea. Picture. Again, all these are challenges, but at every step, we did everything with a good passion, and that turned out to be beautiful for the patients. The only thing which makes us happy is see the patient happy the same day or the next day, see happy and make them happy. That makes a lot of changes for us. And this is our India's first robotic breast surgery program. It's called RoBreast, which we have got it in Apollo Cancer Center, Tenapet. Again, we are very happy with this. Again, there's a small video about the patient, what she felt.
नमस्कार, मैं आसाम से हूँ। मेरा एज 37 है। जुलाई 2023 को मुझे नाम फील हुआ था राइट ब्रेस्ट में, और फिर बायोप्सी रिपोर्ट में पॉजिटिव आया था, और फिर हम चेन्नई आए, यहाँ पे फिर 20 साल से मिले। उसके बाद मुझे 8 केमो दिया गया। उसके 6 महीने बाद मेरा सर्जरी था। जेनेटिक टेस्ट में BRCA1 पॉजिटिव आया, इसलिए मुझे पीछा ने डबल मैस्टेक्टमी और ओवरी निकालने की सजेस्ट किया, और उन्होंने रोबोटिक सर्जरी का सजेस्ट किया, जिससे मेरा रिकवरी बहुत स्पीडी होगा, ऐसा बोला। रोबोटिक सर्जरी में मेरा डबल मैस्टेक्टमी हुआ और फिर रिकंस्ट्रक्शन भी हुआ। रोबोटिक सर्जरी हुआ इसलिए मुझे इतना पेन नहीं हुआ, मेरे दोनों ब्रेस्ट निकाले गए और सेंसेशन भी जल्दी आ ही गया, और मुझे पता ही नहीं चला कि ये सब कैसे हुआ, और मेरे दोनों ब्रेस्ट मेरे साथ ही ऐसा ही लग रहा है। रोबोटिक सर्जरी करके मैं 1 हफ्ते में नॉर्मल हो गई। डबल मैस्टेक्टमी भी, रिकंस्ट्रक्शन भी, ओवरी भी मेरी निकाली गई। अगर आप लोग भी रोबोटिक सर्जरी का एडवांसमेंट लेना चाहते हैं तो ले सकते हैं। पेन भी नहीं होता, इतना पता नहीं चलता, और बहुत स्पीडी रिकवरी होता है इसमें। डॉक्टर सर बहुत एक्सपीरियंस सर्जन है, खूबी से मेरा ऑपरेशन किया, और यहाँ के अपोलो हॉस्पिटल के स्टाफ भी बहुत ही अच्छे हैं, बहुत ही पेशेंट का बहुत ही अच्छे से ख्याल रखते हैं। Thank you.
Again, see, the most important thing which I like this quote, we are limited not by our abilities but by our vision. I think I need to thank my colleague Dr. Priya, who was the vision behind it. And again, both of us collectively put all the effort to make some changes in people's life. And again, I'd like to thank our management for absolutely giving us all the support to go through this good program. And again, I'd like to thank the Intuitive Surgicals also to help us in supporting in Euler and Euler. Hope this makes a lot of changes in people's life. I'm very happy to share our case. Thank you.
Thank you, sir. Very illuminating indeed. We would now like to throw this floor open for question and answers from all of you. And our esteemed surgeons and doctors will answer these.